Hello everyone, hope you're doing well. I'm well aware the Part 3 MRCOG exams are just around the corner. You're feeling anxious, overwhelming. I can totally relate because I have been there too. So that's why I have decided to come up with a session to discuss about what one should be actually doing on the day of exam or just a day before the exam, the real practical stuff, the mindset, the little things that actually going to make a big difference for your big day. So, my goal today is to walk you through some tips and insights that I wish someone had shared with me before my exam. This isn't just about ticking boxes, it's about going in with confidence, the calmness, and the clarity. So, treat the session like a conversation. If you have any concerns, you can put it in the comment box. We are all here to learn together and support each other, isn't it? So, let's dive in, take the stress out of part 3, one step at a time. Let's take a look at this slide. Identify this person. Yes, you heard me. It's pretty much all of us, right? The night before the OSCE exam, mindful of questions, the anxiety, the palpitations. What should I bring with me to the exam center? Can I carry the water bottle? How early should I arrive at the exam venue? Can I use the washroom before the exam? What are the rules? How should I manage my nerves right before entering the station? Can I ask a role player or examiner for clarifications during the station? Lot many questions. Let me tell you something, this is all normal. So these thoughts are part of the journey. Understand that. Every strong candidate has had them. But the goal today is simple. We are going to break these questions and tackle them one by one and leave you feeling calm, prepared, and focused mindset because the truth is, you don't have to know each and everything. Just you need to know how to be safe, structured, and patient centered. So let's get into it, sort the clutter in your head. Before we jump into all the details, let's start with the basics, the most fundamental points, the simple stuff, yet it actually going to make a big difference to how well you will perform on the exam day. That's why I have included these points as well. Things to be sorted well in advance are your travel, accommodation, the attire, exam venue. If you are traveling from a different country, then I highly recommend reaching 2 to 3 days prior to the exam day. This gives you time to recover from the jet lag, adjust to any time zone differences, settle down without any additional pressure. If you're traveling to some other city within the same country, try to reach at least a day before. It will save you from any last minute delays, transport issues, or any other stresses of rushing on the day of exam. Whether you're flying, taking a train, bus, driving, check for any cancellations or changes ahead of time. See, this is very subjective opinion. So this is what I want to tell you guys. Few people, even if they are traveling to different city within the same country, they want to reach 2 to 3 days prior and they want to settle down there, that's also fine. So it is all up to you, but the minimum one day prior to the exam, if it is within the same country, or if you're traveling from a different country, then 2 to 3 days prior, this is what I highly recommend. One thing I really want to highlight, and I always tell my students to do this when you trial run a day before the exam. I did this myself during my MRCOG exam. I went to the exam center the day before, walked around the building, found the exact entrance, figured out the floor, and I even timed how long it would take me to get there from my hotel. You know how that helped me? It completely removed one layer of my anxiety. On the day of the exam, I wasn't wasting my mental energy wondering, am I going the right way? What if I get late? What will be the usual traffic in this road? Where exactly do I enter? Is it a front gate or a back gate? Which floor I am supposed to go? Where is the exam happening? Trust me, knowing exactly where you need to go helps you start the day calm, focused, and you will be much in control. Don't rely on the Google Maps alone. Actually go there, see the building, walk in if possible. You will thank yourself the next morning when you're not in a panic and your mind is clear to focus on what really matters. Tell me what really matters. Nailing your stations on that day. So, I highly recommend doing this exam when you trial run a day before. Having said that, let's talk about what to wear on exam day. This is the usual question coming to your mind all the times, something that might seem small but really matters. Is there any dress code, a strict dress code by the RCOG? No, not really. But that doesn't mean that it's not important. Your attire reflects professionalism, so choose something that is comfortable, neat, and tidy. Avoid anything flashy, loud, or overly casual. You're not dressing to impress anyone. You're dressing to feel confident, look appropriate for that clinical setting. Stick to some basic colors: white, blue, gray, or a beige. These tones give a clean and professional vibe and help you feel calm too. And most importantly, wear something that lets you focus. So, why I am saying this? Imagine you're standing in a station and trying to remember the key points you need to cover, and you're constantly adjusting your sleeves, fixing your scarf, or feeling uncomfortable in the tight shoes. These little distractions can slowly chip away at your confidence and break your flow. That's why I always say choose comfortable clothing that fits well and lets you move naturally. You know what I mean. You want your full attention on the role player or examiner, not on your outfit. And one more thing I have noticed, some candidates wear mini heels or stilettos just because they think it matches their blazer or look smart. But on the day they're struggling to walk confidently between the stations, or they're taking more time to walk in between the stations, or even stand comfortably within the cubicle, trust me, it's not worth the pain. When your clothes and shoes aren't bothering you, you come across as calm, confident, and in control, isn't it? And that is exactly the impression you want to give in your MRCG Part 3 examination. So, comfort is the key. So, let's move forward. What should one be doing one day before the exam? See, this is again a quite subjective opinion. Every candidate is different, isn't it? So, one day before the exam, what I would have done in your situation. So, one day before the exam, I don't want you all sitting and rehearsing the entire stations like you're starting from scratch. You have practiced enough already, isn't it? Say, for example, you will open one station, go through the role player instructions, go through the domains, go through the task, then you start your introduction, the agenda, the confidentiality, the history gathering, examination, management. No, don't do that. You have practiced enough already for this day. Now it is the time to revise smartly, isn't it? Don't exhaust yourselves. Instead, keep yourself occupied with some high yield summaries, or if you have made some quick recall points. Say, for example, I have listed out a few topics which I find weak at. Say, for example, sexual abuse station, opioid abuse, female genital mutilation, some stations like that. So I also had made a point, what are the patient safety points? Say, for example, in the HRT, I shouldn't be forgetting to ask a family or a personal history of the breast cancer, the clots, the smoking, the BMI. And I revised I revised my cancer staging and staging related staging wise the treatments, simple ones, whether you do the radiotherapy or a chemotherapy, or you would do the surgery, something like that. So this will help you. um, your mind will also, you will not feel stressed, and you have got this. You know, you just, if you want to revise, you just revise it smartly, and You guys can't revise everything. You can list out some 15 to 20 topics which you want to revise. Okay, so do not try to exhaust yourselves the day before the exam. And another question is whether to revise or relax, what to do on the day of exam. Not everybody will have exam in the morning. If you have an exam in the morning, then you will get going. But if you have an evening session, you have so much of time. And yeah, I totally understand your situation. What should one be doing at that point of time? There is no one size fits all. Go with what works best for you. If you think the light revision calms your nerves and boosts your confidence, go for it. But again, keep it focused. Just review some phrases or frameworks or checklists. On the other hand, if revision makes you anxious, then skip it. Please. Focus on calming your mind, breathing. Just trust your preparation. Take a walk, breathe yourself, hydrate yourself. The bottom line is entering the station with a clear head and confident mindset is all important. So just do what works best for you. So let's look at this slide on the day of the exam. On the day of your OSCE exam, you will be assigned either a morning or evening session that you're already aware of. Depending on your slot, you will be instructed to arrive at a specific time that you have already received on the email. Just be aware of that. Upon arrival, you will gather with fellow candidates in a designated waiting area. During this time, you're allowed to eat or drink, use your phone, so it's a good opportunity for you to relax and mentally prepare. Then, at the scheduled time, your facilitator would come and they will guide your group to the next area from the waiting area. This process to ensure that candidates from the different sessions, say for example the morning session, do not interact and with you people, and maintaining the integrity of the exam. Before the exam begins, you will be asked to store your personal belongings securely. Rest assured, you will have access to the rest room, the facilities before the exam starts. So remember, this waiting period is a chance to calm your nerves and focus. So everyone around you is in the same boat. So take deep breaths and stay confident. So remember, this waiting period is a chance to calm your nerves and focus. Everyone around you is in the same boat. So don't try to revise there. So just take deep breaths and stay confident. Hydrate yourself. If you want to use the restrooms, do that. So, the reason why I have put this picture is this was quite shocking for me as well. That's why I want to discuss this. When you enter the exam hall, you will see the two exams are conducted simultaneously. For instance, 28 candidates may be appearing for 14 stations with two separate circuits running side by side. The cubicles are placed close to each other, often back to back or side by side. It differs from the exam center to center. So, and here is why I'm telling you this. The setup might feel a bit chaotic at first. You will hear voices from the next cubicle, and honestly, it can feel like a bit of fish market when the exam starts. I remember feeling quite anxious, and I kept thinking, will the examiner hear me clearly? Can I even focus with all this background noises? But here is what I realized, and I want to highlight this point. Within 5 minutes of being inside the cubicle, you automatically zone in. Trust me. Once you start engaging with the role player or the examiner, your focus shifts. You just need to remind yourself to be loud and clear enough for the examiner and the role player. Most importantly, listen actively to your patient. Tune out that background noise because your performance is about your communication, not the room's chaos. So please just zone in where you are, be situationally aware, be loud and clear enough to be heard by the examiner and the role player, and listen actively to your patient. and do not give importance to these rooms chaos and other background noises. Now the most important question everyone keeps asking me, that crucial 2 minutes reading time in MRCOG part 3, what should one be really doing? I will stand outside the cubicle, the bell rings, but I don't really know what to do in the 2 minutes and how wisely I should be utilizing the 2 minutes of time. So, what should I do in the 2 minutes reading time before the task begins? I know many of you wonder, but here is the thing, in some stations, you may encounter the station being quite lengthy, multiple pages on the wall. There may be a page listing the domains, another page describing the task, plus some supporting documents like a GP letter, Mears chart, post operative notes, or even some referral summaries. So don't assume it is just one paragraph to read. Be prepared to scan quickly. That's why I have put it up. Be prepared to scan quickly, develop the skill of rapid reading. In those 2 minutes, your goal is to understand what the task is asking, pick out the key red flags or the critical points in the background information, mentally map how you will open the the station, and structure your approach. I know this is very theoretical, so I want to give you some scenario. So let's look at the scenario together so that you will understand how you should be using wisely your 2 minutes reading time. So the first thing is that let's look in this first page. Let's look at what type of station is this. That's all you have to do first. Is it a patient simulated task? Is it a simulated colleague task? Is it a structured discussion? Is it a labor ward prioritization? What type of station is this? If it says patient simulated task, until unless it's a debriefing station, you have got almost all the domains. Information gathering, communication with the patient, applied clinical knowledge, patient safety are all bound to be there. So already my brain is in consultation mode. This to decide on this, it would hardly take 10 seconds for you. Now let's look at what's going on here. In the second page, she is a 42 years old lady, Mrs. Brenda Williams, underwent TLH-BS4 6 months ago for her stage 4 endometriosis, and she is experiencing some hot flashes and mood swings. So immediately I am thinking this is a case of surgical menopause. So this would take another 20 seconds for me to figure this out. Then there is a big post-operative notes given. The operative notes given. So I don't waste too much time on every detail here. I don't need a hospital number. I just skim and pick out what matters here. So this is a stage 4 endometriosis, TLH-BS4. And then, okay, all right. Okay, this is some left ureterolysis was done. Okay, so what do I understand from this? Probably some complex surgery, isn't it? That's all. Again, this would take another 30 seconds. Now, here is what I do, and I really recommend this. Write her name and age on your notepad. This is applicable to all the stations. Trust me, once you're inside that cubicle, you might completely forget her name and you don't want to be that one calling her ma'am or mixing up names. It just looks so sloppy, right? So this takes me like 5 to 10 seconds, but that's very, very important. So even after doing all of this, I still have got a good 20 seconds to spare. So I mentally prepare myself. Okay, I'm going to go in, greet her warmly, ask how she's doing since the surgery, and then ask why she's here today. So this is about the surgical menopause. So I need to screen for contraindications to the HRT, which is smoking, BMI, any medical comorbidities like hypertension, whether there any family or personal history of breast cancers, stroke, MI, clots. So this is what I think of in my next 20 seconds. That's it. You're ready to begin the station. So I have divided this into 4 steps. Step 1, glance at the task box. First 10 seconds. What type of task is this? Simulated patient task. What domains? Okay, these are my domains. And step 2, skim and summarize the clinical information in next 30 seconds. Which is, she is Mrs. Brenda Williams, 42 years old, TLH, BSO 6 months ago for stage 4 endometriosis, now comes with menopausal symptom, some urethrolysis. Make smart notes, which I already told you what to do. Write her name and age and some contraindications of the HRT which you don't want to miss in this, like family or personal history of breast cancer, stroke, DVT, MI, smoking, BMI, those questions. So, for the next 10 minutes, your entire focus is Brenda Williams in the exam. Nothing else matters. This is your patient, your priority, your world for the next 10 minutes. You're not here to show off every line of the guideline. You're here to be relevant, safe, and patient centered. That's what earns you the marks. So you should remember this. Your focus stays only in this task for the next 10 minutes. This is exactly how a smart candidate secures the majority of the marks, by staying focused and doing exactly what is necessary within those 10 minutes. Don't overcomplicate it, don't get into unnecessary details. Just stick to the task and stay safe and keep the patient at the center of your approach. That's how you score well. Similarly, guys, you might come across some other. Here, I have given you the operative notes, which may not be very relevant in the station. However, you have to go through it and quickly scan what is necessary. You might come across a partograph, MEOS chart, or some drug chart in the station. So, the key is don't get overwhelmed. Just see what is necessary. You're not there to read every line like a novel. You're there to extract the important stuff fast and act on it. Let's say it's a patient with some suspected sepsis. Go straight to the last set of observations. What are you looking for? She's likely to be a febrile. Usually, RR, respiratory rate will be raised, tachypnea will be there, blood pressure may be low, tachycardia will be there, urine output usually will be low. You're looking for a trend. That is where the MEOS chart and other sheets would help you, right? So look for the last observations which will give you the idea about this suspected sepsis case. And in case of acute kidney injury, look for some red flags. She might be on some nephrotoxic drugs, or she might be dehydrated. Urine output, her creatinine is high. Yeah, you have got a clinical picture. That's all you need to explain it to the patient or as a part of your structured discussion. So these are your vital signs for the brain. Quickly scan, store them, go in with the context which you have already formed. You don't have to remember the numbers. You don't have to remember each and everything. Just by scanning that document they have provided you with, you need to know what is the context. This is how you stay ahead in a data-driven stations, by reading with purpose, not passively. So you will come across a lot of charts in the OSCE. So don't try to remember all the values. Remember how to think, and that's what will make you look sharp and stay safe. Having said that, we will move to some other topic now. Few candidates will come and tell me that I have messed up one station. Am I gonna fail? Let me tell you, that doesn't mean the game is over. If you feel like you have messed up one station, do not panic. It's really not the end of the world. Lot of people think it's a straight pass or a fail per station. But the reality is the exam is way more complex than that. Each station is broken down into multiple domains. You have got information gathering, communication with the patient, communication with family members, communication with a colleague, applied clinical knowledge, patient safety. So, even if you feel like you didn't answer one domain properly, you might have absolutely nailed the communication part, or you would have scored well in the patient safety or applied clinical knowledge. that still gives you a pass in some domains, isn't it? And here is the thing, you will never really know which domain you did well or not. No candidate can break that down during the exam, and you don't need to worry about it, isn't it? Leave that to the RCOG. Your job is to stick to the basics. If it's a weird or a totally unexpected station, no stress. What do you know? How to do this? Take a good history, relevant questions, communication. You do what you're good at. At least that will take care of those domains and you would fetch marks in that. Sometimes you're not quite sure about the questions being asked by the role players, say for example. So, what you can do at that point of time is that you can say something like, I'm not quite sure about this. I would like to discuss it with my consultant to make sure we what we do and what is best for you. Or even like, would it be all right if I give you some leaflet with more information while we arrange for a follow up? That is still safe. That is still a good OSCE technique. That's how you score points when you're not sure. So please do not carry one bad station into the next. Reset, refocus, go again. You are being tested on the overall performance. And that one tricky station is just a small piece of it. So you have got this, guys. Then a few other candidates, 5 stations didn't go well. You must be thinking, yes, that's it, I have failed. I'm not gonna do well for the rest of the stations. No, not necessarily. Same rule still applies. This exam isn't about how many stations you think you smashed or struggled in. It's about your overall performance across all the domains, all the stations. You might have done borderline or even poorly in a few, but then picked up strong marks in others through the patient safety, communication, teamwork, anything for that matter. RCOG has a complex marking system for a reason. It is designed to balance out the fact that not every station should go perfectly for anyone. So please don't spiral just because a few felt off. You could still absolutely pass. Take this from me. There is um, the another thing which I want to discuss, which most of the candidates keep doing this in the exam. I don't want you guys to do this. The moment the bell rings, the previous station is done. Keep that in your mind. Whether it went great, it went badly, leave it there. You don't have time to think about it. You still have so many stations to go, and you need to keep that energy going. Because the 2 minutes reading time for your next station has already started. That clock is ticking, so don't waste even 10 seconds replaying what you said or you didn't say. It's gone, it's done and dusted. Examiner is writing, you need to be reading for the next station. Walk out, breathe, reset, and go again. The best candidates, they don't dwell. They flow station to the station with the same focus and same calm. Be one of them. Bell rings, mind resets, you move forward. This is the step. Reset your mind soon after the previous station is over. Why I am saying this? You need to respect the time. Once that bell rings, you need to stop talking immediately. Don't waste even one more second standing in that room. Because whatever you say after the 10th minute isn't going to be marked anyways by the examiner. You will only be eating into your next station's time, and trust me, you're going to need every second to read and think about the next task. So, the moment the bell goes, thank the patient, smile quickly and professionally, leave the cubicle, go straight to the station. You cannot afford to hang around. Reset your mind, prepare for the next battle because your 2 minutes reading time is already ticking. Every second after the bell is a second stolen from your next station. So protect your focus, protect your time, and keep moving without wasting any further. Let's move to some other topic now, which is also a question generally asked by the candidates. Do you speak to the examiner? Can I speak to the examiner? Can I speak to the role player if I get any doubts in between? Guys, know your boundaries. Most of the times, usually it shouldn't be creating any confusions if you have practiced well enough, but I have seen few candidates telling me I just got confused between the type of task. I assumed it is a structured discussion, it turned out to be a patient simulated task. And you feel, you know, yeah, I understand your situation. It might happen to anybody in that stressful situation. So that is why I stand. That's why the first thing I told you, when you stand outside the cubicle in the 2 minutes reading time, you need to know what type of task you're going to deal with and zone in that way. If it's a simulated patient tasks, you're not going to interact with an examiner, you're not wishing them, you're not asking any permission to enter the cubicle. May I come in? No. The moment the bell rings, you just walk in there, just take a chair, sit there, start your introduction, and begin your station right away without wasting much time there. In a structured discussions, yes, that's your moment where you will have a complete discussion with your examiner. So, as far as the structured discussions is concerned, this is again a huge topic to discuss, but I will just give you some tips and tricks that you need to do on the day of exam, because every minute counts in a structured discussion too. So, in a structured discussion, you actually get 10 full minutes, and honestly, that can feel long if you use it wisely. And so, here is how I would suggest you to go about it. When you sit down, first just say you're ready to begin and let the examiner start the questions. Don't rush in with your own agenda. You're not here to make up your own agendas and just keep on talking about it. And when you answer, be to the point. If they ask you to summarize using S bar, then only do S bar. Don't start giving extra history or unnecessary details there. That's not what they asked for. Hope you're getting my point. Also, after you finish answering a question, say for example, they asked you to summarize a case using S bar tool and you have completed it, pause for a second there. Give the examiner a chance to understand, comprehend what you have told, and also to move on from there. Now, structure is everything in the station. Try to organize your answers. You can break it into categories like diagnosis, differential diagnosis, investigations, management, any governance points at the end. And always think out loud. If you're saying something, why you are saying this? Why you are thinking of these differential diagnoses? Why you want to do these investigations? And why you want to give these options? You need to share your clinical reasoning, justify your actions, and that is how you score good marks. Don't talk like a robo there. That you want to do this, you want to do that, you want to do this. No, you should always think out loud. You need to tell what you're thinking and why you want to do this. If you are unsure, still tell that you are not quite sure, but still you want to do this. And use guidelines if you want to refer to the evidence just to get good marks in your applied clinical knowledge. You can say as per the RCOG green top guidelines or based on the national recommendations. And communicate like a leader. This exam is set at the level of ST5, who is a senior registrar. So show some confidence, calmness, clarity, and you have got 10 minutes. So you don't have to hurry. You have got, good amount of time. and avoid any robotic or hesitant tone. So, yeah, be confident and manage the time well as well. So, keep your answers focused and concise and let the examiner move the discussion forward. A few examiners will usually want you to stop and then they will give you the questions. Few wants to just tell everything. So it all depends. It differs from examiner to examiner, but you need to understand what what is his style of taking the structured discussion. So for that you need to give some pause and analyze it. All right. Having said that, we will move forward to the topic which I want to discuss is the lay examiner stations. Lay examiner alert, your communication is under the microscope. Yes, you heard me right. Lay examiner in the room, time to shine with empathy. Stations with lay examiners, win them with words. Yes, remember, you have entered a station where the patient is seated and two examiners are present, one of whom is a lay examiner, most likely. These are typically communication focused stations, something like miscarriage, where you have to you have to do the breaking bad news component, or you have to debrief the station where she has this patient with intrauterine fetal demise, um, things like that. So majority of your marks will come from how well you communicate, and so be mindful and score high by demonstrating empathy, clarity, patient-centered care. If you have compromised your marks if you compromise your marks in some other stations, especially your communication with the patient, if you do well in these set of stations, then automatically your communication with the patient, yeah, it gets compensated, of course. That's why be mindful and score high by demonstrating all this communication skills, especially when you encounter such a cubicle where there is a lay examiner. All right. And how do you understand that? Most likely there will be a two examiners. Otherwise, there will be one examiner and one role player. So, coming to this slide now, one station that keeps popping up in everyone's worry list. What is it? Yeah? Labor ward prioritization? Yes. But honestly, I can talk about labor ward prioritization the whole day. It's a station that deserves its own full session. That's a different topic, and we will definitely come back to it in detail. But for now, let me give you a few quick and high yield tips that you can follow on the day of the exam, things that will actually make a difference. So, everyone says this one gives me a headache. Almost every candidate has said the same things. I run out of time. I get anxious the moment I see 8 rooms on the board. I don't know how to start or what to say first. It's completely normal to feel this way. This station feels difficult because it tests so much at once: your ability to read, to think on your feet, to prioritize safely, and to communicate clearly under pressure. And another thing I want to tell you is that out of the 14 station, one candidate is going to get this labor ward prioritization as their first task. It could be you. Just be mindful. You might be getting a labor ward prioritization as your first task. You may be not very comfortable doing this station. It's fine. It's not the end of the world. Do it more comfortably. And then, even if it doesn't go well, it's fine. Just move on with other stations. Anyways, other candidates will also come to that station eventually, but you're the one who started off with. It's fine. It's not going to make any difference for the overall performance. So just be aware of this as well. So with the right strategy, structure, and the calm mindset, you can still master the station, I would say. So let's break it down together step by step. Before anything else, identify who is with you in the team in that first 2 minutes. I suggest you to quickly write that down if you're comfortable to do so. Like you have consultant, you have a senior midwife, you have SHO, you have FI1, you have ST1, anesthetist, neonatologist, something like that. This will help you to decide who can take over which room. So I used to write it quickly on my by taking some 10 to 15 seconds on my notepad that who are there in my team. So you still have another 1 minute, 30 seconds left. So quickly scan through all the rooms on the board. You don't have to go through one room and then you decide what you should do in that room, categorize it, who will go there. No, you don't have so much time there. Just quickly scan all the rooms and decide, identify which are the 2 to 3 urgent rooms you are going to begin your discussion with inside the cubicle. Plan which one you will attend personally, which one to delegate, and which one to escalate. Because most of the times there will be 2 to 3 urgent rooms, and generally it will be you or a consultant or a senior midwife depending upon the circumstances. So get this sorted in 2 minutes of time. Say, for example, if you couldn't finish reviewing all the rooms in the first 2 minutes, do not panic. Enter the station and politely say I will just take a moment to complete reviewing the board before I begin, and the examiners will be okay with that. So spend 1 to 2 minutes doing so and then proceed. And prioritize clearly and speak with purpose. I have seen candidates narrating the whole case from the board. In room number 5, we have a primary gravida. She's 39 weeks, IVF pregnancy, smoker, with BMI of 26, comes to labor room contracting, and her PV findings are like this. She's having PV bleeding, and then you will go to prioritize who will go and then what to do. Why you want to do that? That would take like 40 to 50 seconds to say all of this, what I just mentioned. Instead, what you can do is that confidently and clearly announce, I will begin with room number 5, the most urgent case. Give a brief pause there. Let the examiner register what you're trying to say. Then you present the case using SBAR format. That is how they communicate in the clinical areas. So SBAR tool is how you should be telling the consultant. So you can continue saying, I myself would attend this case with one of the midwife. Depending upon the scenario, I would like to escalate it to my consultant. The situation here, I have a suspected case of abruption or a fetal distress. I'm just giving you an example. It is not the exact representation of the cases. On the background, she's primary gravida, 39 weeks, contracting. And for my further assessment, do we have any further details on her observations, PV findings, estimated blood loss? Because you need these findings. Unless you ask these findings, they are not going to give you. If there are any further information, they're going to give you. If no, they will tell you no further information available. But if you ask just like that, a vague statement like, do we have any more information? Then they will ask you, what more information you want to know, doctor? You need to be specific because there is a marks there. Assessment has got marks. So you need to be specific, asking what are her observations, PV findings, and estimated blood loss. Then they will tell you, they'll give you. Otherwise, it will be a to and fro questions, what you want to know, and then again you want to repeat it. It's just a waste of time, isn't it? Then based on the observations, they're going to tell you, you need to you need to give your recommendations. Whether it's a MOH protocol, just tell that I would activate the major obstetric hemorrhage protocol. You don't have to tell what you're going to do within that, because the station is not about discussing about the MOH protocol. You still have got 7 rooms left to discuss. So just tell that I would activate major obstetric hemorrhage protocol. I would involve my consultant, senior anesthetist, IV access. I would send the bloods, prepare for category 1 LSS. I mean, depending upon the context, not necessarily this is the station what you're talking about. Yes. So communicate with impact. Use assertive phrases. This is my top priority. I would delegate room 2 to the midwife as it is a stable case of early labor. Room 4 will need consultant review due to CTG concerns. Another communication tip for your labor ward prioritization station is when you are moving on to discuss the next urgent room or any other room for that matter, pause for a few seconds and clearly state aloud. Now I am going to talk about the next urgent case, which is room number 7. This short pause gives the examiner time to finish marking the previous room, as definitely there'll be some slight lag in the documentation, isn't it? You're talking and keep on marking it, and you may or may not give the answers in a structured way, so they have to they have to find it out and they have to mark it. So there will be definitely some lag in the documentation. If you continue talking without a clear transition, examiner might interrupt you with, sorry doctor, which room you're talking about now? So they don't know which room number you're talking about, and whatever you have said a few seconds earlier, they must have not registered it. That is why before you move on to the next room, pause for a few seconds and clearly state it which room you're talking about now. That small interruption can break your flow and cost you valuable time. So always pace yourself and signal each transition clearly. So yeah, coming to your next slide, which is on the teaching task. The teaching station tip, the moment you see which is a simulated colleague task, a teaching task, just tune yourself to make sure that you tell all these 10 points, because the teaching tasks are usually the easiest ones and you can score really well. You need to be calm and friendly. You should enter the cubicle with a happy face and use a warm tone to make the conversation light and comfortable. Eliminate the bullying or undermining component. Ask her why she is interested in this topic. Praise their interest in the topic and try to understand what they want to learn from this. That will be your agenda. Start by checking their current level of knowledge. Keep checking if they're following you. Are you clear so far? Am I clear so far? Do you want me to repeat anything? And reinforce learning by encourage them to repeat. When I'm saying this, use simple sentences to for them to repeat. It shouldn't be medical jargons, because there'll be non-medicos. And you make sure that you use the props which are given on the table, pessary or IUCD, Myrena, anything for that matter. And another thing is useful resources you have to provide them with for further study, and always ask for a feedback. How did they find the session? Did it go well? So that is something you guys have to take care of in the teaching task. So do not forget to use any props which are given to you on the table, because in that overwhelming situation you might forget to notice what is even there on the table. So what is the best mindset to keep throughout the exam? This is to summarize: one station at a time. Don't carry the last station into the next. Every cubicle is a fresh start. You're not aiming for a perfection here, you're aiming to be safe, structured, and patient centered. If something goes wrong, move on. Everyone fumbles a question or two. It's your overall performance that matters the most. Reset after every bell. New station is new mindset. Don't replay what you have just did. Stick to your basics. History, communication, patient safety, escalation to the consultant, these are your win marks. Don't chase marks, chase clarity. Be clear, be kind, be calm. Let RCOG handle the scoring. You have trained for this. Trust your preparation, trust your instincts. Walk in like a doctor. All the very best, guys. My prayers and best wishes are with each one of you. Walk in with confidence, stay calm, and give it your best. You have worked so hard for this moment. Now you go in there and shine like the doctor you are. You have got this. Once again, all the best, guys. Do not forget to subscribe this channel. Take care.